Hey everybody, this is Wayne over at the Alchemical Tech Revolution YouTube channel. Tonight I'm going to discuss a little bit of some predictive programming I see coming, and this is about something that they're calling the quote-unquote Twindemic. And what this is explained very succinctly in a recent New York Times article. And this is an article by Jan Hoffman, August 16th, 2020. And the title of it is Fearing a Twindemic. Health experts push urgently for flu shots. Go imagine that. They're pushing for flu shots. There's no vaccine for COVID-19, but there's one for influenza. With the season's first doses now shipping, officials are struggling over how to get people to take it. Okay, listen to that. If you have to convince somebody that they need to take this, first of all, that should be very telling on the face of it about what it is about these things that people need to understand. So let's continue on, though. As public health officials look to fall and winter, the specter of a new surge of COVID-19 gives them chills. But there is a scenario they dread even more. A severe flu season resulting in a quote-unquote twindemic. There it is, straight from the New York Times. Even a mild flu season could stagger hospitals already coping with COVID-19 cases. Really? Like, I don't see hospitals struggling in the least with COVID-19 cases right now, but, they have to kind of stick to the narrative, don't they? Let's go back to the article. And though officials don't know yet what degree of severity to anticipate this year, they are worried large numbers of people could forego flu shots, increasing the risk of widespread outbreaks. See that? They're afraid that people refusing to get flu shots is going to make people sicker. That's nonsense on the face of it right there. Because the flu shots that they do give, even by their own numbers, are ridiculously ineffective. So shouldn't even be a thing. And then even if you don't take into account the Department of Defense's own study that showed that you were 36% more susceptible to contracting a type of coronavirus from getting the flu shot, then if you throw all that out the window, even it still doesn't even make sense then. But let's get back to the article. The concern about a twindemic is so great that officials around the world are pushing the flu shot even before it becomes available in clinics and doctors' offices. Dr. Robert Redfield, director of the U.S. Centers for Disease Control and Prevention, has been talking it up. And listen to this next part. Urging corporate leaders to figure out ways to inoculate employees. Listen to that. They're trying to make corporate businesses and stuff force their employees to vaccinate. They're trying to figure out ways to make them do that. That's wonderful, isn't it? The CDC usually purchases 500,000 doses for uninsured adults, but this year ordered an additional 9.3 million doses. Okay. So normally they buy 500,000 doses to try to give to people for free, but now they bought an extra 9.3 million doses. That's 9.8 million doses that the CDC plans on giving out for quote-unquote free. But you know as well as I do, folks, there ain't nothing free in this world. And if it's free, you're the product. So remember that. Okay, let's continue with the article here. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease, has been imploring people to get the flu shot, quote, so that you could at least blunt the effect of one of those two potential respiratory infections, end quote. In Britain, Prime Minister Boris Johnson has been waging his own pro-flu shot campaign. Last month, he labeled people who oppose flu vaccines as nuts, and announced that the country's largest ever rollout of the shots. In April, one of the few reasons Australia allowed citizens to break the country's strict lockdown was to venture out for their flu shots. What do you know? Okay, now you could go out today, but only if you go get your flu shot. That's remarkable, isn't it? That should be telling there too. The flu vaccine is rarely mandated in the U.S. except by some healthcare facilities and nursery schools. But this month, the statewide University of California system announced that because of the pandemic, it is requiring all 230,000 employees and 280,000 students to get the flu vaccine by November 1st. Okay, here's an aside here, folks. This Institute of quote-unquote higher learning, they're demanding that their students and their faculty and everybody that works there get a flu vaccine. Like, really? It's I could understand maybe logically a healthcare organization or something like that, a healthcare facility, but come on. That's just beyond ridiculous, but this is what they're trying to do, and they're trying to make all corporations and stuff follow suit with this. Okay, let's get back to the article. A life-threatening respiratory illness that crowds emergency rooms and intensive care units, flu shares symptoms with COVID-19. Yeah, no kidding. Fever, headache, cough, sore throat, muscle aches, and fatigue. Flu can leave patients vulnerable to a harsher attack of COVID-19, doctors believe. There's the key term again, believe. They don't know. And that's the bottom line. They don't know, but they believe. Well, you could believe anything, and if you're wrong, you're still wrong. It just, you could believe it all you want, but that's the bottom line. If you're wrong, you're wrong. But anyway, where were we here? So, okay, flu can leave patients vulnerable to a harsher attack of COVID-19, doctors believe, and that coming down with both viruses at once could be disastrous. When have you ever heard of, a double viral infection at a time like that in something like this? That's the same thing. It would get classified as flu. Like think about it. They wouldn't bother to test for both if it was anything other than COVID-19. Like if you had a common cold and the flu at the same time, if you went to the doctors and got tested, they would just call it the flu. If you had both, and they tested you for the flu, they'd say, okay, you had the flu. It wouldn't be a consideration that you had both, because guess what? The symptoms are very similar for both, so one might as well be the other. And honestly, that's kind of what we're looking at here. They're just grasping for straws here, folks. They're just desperate. They want to get everybody injected with this lethal poison as quickly and efficiently as they can. And make no doubt about it, vaccines are poison. Plain and simple. It's poison. They're injecting your body with poisons to try and make your body react to it and have an immune response to it, like your body would normally do with any kind of a pathogen that enters your body. And that's what this is. They're injecting you with pathogens to make your body react to it. And then if you take into consideration, like I had mentioned earlier, the Department of Defense study that showed that people who got the flu shot last year were more susceptible to coronaviruses in general. And what is COVID? It's a coronavirus. They're not saying anything different than that. It's a coronavirus. They'll admit that readily in the mainstreams. You're really taking a gamble here. I mean, which study do you want to listen to when it comes to this stuff? It's just goes to show how these studies are all bought and paid for, like, already. So, you could show anything you want just by tweaking the data. And I've seen this over and over again, especially in vaccine studies, how they just tweak the data to show whatever it is they want. They come up with the outcome that they want first, and then they'll just tweak whatever data they have to match that and put it out as a study, and lo and behold, goes through. Because here's the bottom line, folks. Vaccine manufacturers, they have no liability. So therefore, they have no reason to do any kind of real safety trials on things or any real reason to make an effective product. They have no liability. So that should be concerning. Like if you were to buy, say, I don't know, any kind of food, say if you were to go buy food, say it's chicken, okay? Say you go buy like 10 pounds of chicken from a processing plant that, first of all, has no liability. They have their liability waived by government, so that if you get sick from eating it, they're not liable. And what would you think about that? Would you want to buy that? Think about it. It doesn't make sense. They have no accountability and no liability for anything. They can't be held accountable or liable for any damages that it causes or any illness that it causes. That's how it is with this flu shot in particular. So let's get back to the article. I kind of went on a little sidetrack there. The 2019-2020 flu season in the United States was mild, according to the CDC. Yeah, mild because everything got classified as COVID, but that's a different story altogether. But a mild flu season still takes a toll. In preliminary estimates, the CDC says that cases ranged from 39 million to 56 million, resulting in up to 740,000 hospitalizations and from 24,000 to 62,000 flu-related deaths. That's interesting, isn't it? According to the CDC, flu season occurs in the fall and winter, peaking from December to February. What do we know about that time frame, folks? The 12/21 or the 33 encoded there. The winter solstice, the low point of the sun, the low point of man's health, the low point of man's spiritual concerns, things of that nature. This is when flu season occurs, and that's not a coincidence. There's reasons for these things, and there's kind of what you would call like mystic type reasons for these things. The energies in play during those seasons definitely have an effect on people's health and well-being. So that's part of it, and this is why flu season is a big thing. And always has been. I mean, for as long as I can remember, there's always been flu season. People get sick every year with the flu. It's something that happens, despite the fact that they have a vaccine for it. And that could be said for just about any other of the quote-unquote vaccine-preventable diseases. They have vaccines for them, but guess what? People still get them and get sick from them. That's what happens. A vaccine's not a cure-all. And they're trying to treat this whole thing like the vaccine's the cure-all. Anyway, back to the article. So, flu season occurs in fall and winter, peaking from December to February, and so it was nearing its end as the pandemic began to flare in the United States in March. But now, fighting flu proactively during the continuing pandemic, there it is, continuing pandemic. There's no end in sight for this thing, folks. They're going to drag this out as long as they can, until people just wake up and say, enough. I'm done with this nonsense. But anyway, back to the article again. I get a little sidetracked sometimes. But now fighting flu proactively during the continuing pandemic presents significant challenges. Not only how to administer the shot safely and readily, but also how to prompt people to get a shot that a majority of Americans have typically distrusted, dismissed, and skipped. And there's very good reasons for that, folks. I'm sure you're aware. With many places where the flu shot is administered en masse now inaccessible, including offices and plants that offered it free to employees on site, and school health clinics, officials have been reaching out to local health departments, healthcare providers, and corporations to arrange distribution. From now through October 31st, publicity campaigns will blast through the social media, billboards, television, and radio. Because the shot will be more difficult to access this year, people are being told to get it as soon as possible, although immunity does wane. There will be flu shot tents with heaters in parking lots and pop-up clinics in empty school buildings. All right, now just as a personal aside here, everybody, when I'm reading this and it says here that the reason they want people to get the shot, quote-unquote, as soon as possible is because it'll be more difficult to access this year, that's nonsense on the face of it, especially if the CDC purchased 9.3 million extra ones to give out for free. They have a massive supply of these stockpiled and ready to go, so that's nonsense on the face of it. The reason they want people to get it early is so that it has time to actually set into your body the right way and present itself a couple months later. And that's largely what happens with these different kinds of vaccines. A lot of times people do not present symptoms immediately after the vaccination, but they develop these chronic inflammation type diseases and stuff several months later, usually 2 to 3 months later. And vaccines do remain in your body and can cause these types of symptoms in your body from 60 to 90 days after the fact. So they want people to be sure to get this early, so that they're looking at trying to get people injected with this flu shot between the September-October time period. So you're looking at this will cause presentation of symptoms to onset sometime December, January. So right in the heart of the flu season. Go figure, right? So that's kind of, what my take on that is. Anyway, back to the article. I know I'm sidetracked a lot with this, but I think it's important that we get the information out there with it. Because of the efforts, vaccine makers are projecting that a record 98 million flu shots will be given this year in the United States. You hear that? In the previous paragraph, they're telling you that because they'll be more difficult to access this year, they want people to get them sooner. But in the very next paragraph, they're telling you that they're projecting record sales this year. 98 million flu shots will be given this year in the United States, about 15% more than doses ordered last year. And here it is. The Kaiser Permanente healthcare system will be flooding more than 12 million of its members with flu shot reminders via postcards, email, text, and phone calls. They're going to spam you about getting your flu shot, folks. All right. So that should tell you something. Anything they're giving away for free, or they're giving you incentives to go get, and they're putting this level of marketing behind it. There's a reason for that, and it's not the reason you'd think. They don't give two craps about your health. Get it through your head. This has never been about anybody's health. This is something totally different. Let's go on here with the article. Pharmacies and even supermarkets are expected to play a bigger role than they have in previous years. Especially those, big box retail chains and stuff. The ones that have been allowed to stay open during this pandemic. The only ones. The monopolies. Boy, I wonder why, Gee, why are they getting preferential treatment here? Why are they going to be the responsible party here? Let's read on. As of this week, Walgreens and CVS will have flu shots available. Walgreens will be hosting additional off-site flu vaccine clinics in community centers and churches. In churches, too. See that? The nerve of them. They're pushing this stuff in the churches. They've shut down the churches and, told the people in California, you're not allowed to sing in church because you could spread this nonsense. But yet they're going to offer vaccines in church. It's okay to open church to go get a vaccine. It's not okay to go to church otherwise. Do you see the hypocrisy here and the nonsense of it all? Let's see. To reduce contact time, CVS is allowing patients to fill out paperwork digitally. In New York City, which averages about 2,000 flu-related deaths a year, the health department has been reaching out to hundreds of independent pharmacies to administer the shots because they are often located in outer borough neighborhoods where the coronavirus has been rampaging. The health department has a detailed online flu vaccine locator. They're tracking where this stuff's going. They're keeping close tabs on the vaccines. Access is a problem for all adult vaccines, said L.J. Tan, Chief Strategy Officer for the Immunization Action Coalition, a nonprofit group that works to increase vaccination rates, who was an early promoter of the term Twindemic. Let me translate that there for you, folks. This L.J. Tan, the quote-unquote Chief Strategy Officer for the Immunization Action Coalition, this is a social engineer. Okay, this is one of the social engineers. This group was an early promoter of the term Twindemic. Adults may think, if I can get the flu shot easily, I might consider it. That's the quote from them. But as difficult as getting the flu shot to people safely will be, perhaps harder still will be persuading them to actually get it. In the 2018-19 flu season in the United States, only 45.3% of adults over 18 got the vaccine, with rates for those ages 18 to 50 considerably lower. Really? So the harder part's going to be to persuade people to get it. Well, what kinds of persuasion are they going to use? I'll tell you what they're going to use. They're going to use the whole, they'll beat you over the head with the whole second wave nonsense. That's what they're going to do, because make no mistake about it, there's going to be a second wave of this, whether there really is or not. The media is going to play it up that there is. So you're going to see, a second wave, maybe not really physically in your area, but you'll see it all over the media, just like everything else. So they're going to push this second wave, and then they're going to blame all these anti-vaxxers for being, stubborn, mindless ingrates that are just refuse to accept the science of it. They're science deniers. They'll use all these terms, and they'll try to shame people into going and getting this flu shot. And then the people will line up to get these flu shots, and then lo and behold, these people will become sick with the quote-unquote COVID-19, and then they're going to turn around and blame all of the anti-vaxxers and the science deniers and all of that, and say that the reason why they're having such vast numbers of this quote-unquote twindemic, or this pandemic, will be because of these people, and because they refuse to listen. They won't wear their masks. They won't get their vaccines. They won't stop going and doing stuff and living their lives. They won't stop living their lives. That's what it's about, folks. They want you to just lock yourself in your house and stay there. Shut up and die. That's what they want for you to do. Shut up and die. That's what they're telling you when you're trying to just go about living your life and doing the things you would normally do. They want you to shut up and go sit in your house and die. That's pretty much what the whole emphasis of this is. And they're trying to manufacture that whole scenario. So, anyway, I know that sounds kind of harsh, but that's essentially what it is in a philosophical kind of way, or a spiritual way. When you look at it spiritually, they want people to spiritually die. They want you separated from your human condition, from the natural world. They want total control over your perception. So they want you to sit home and watch your TV and listen to the authority figures, these men in the white coats that come out and say, "Oh, it's terrible. You need to stay in your house and don't hug your grandma," and this kind of stuff. It's ridiculous. It's ridiculous. We've been around for how long? We've obviously experienced much worse illnesses than this one, and have never shut down the entire world for anything like this. So it's all sketchy, all of it. But back to the article here. Skepticism to this vaccine runs high, particularly in communities of color, because of long-standing distrust and discrimination in public health. A 2017 study in the journal Vaccine noted that, compared with white people, African Americans were more likely to report barriers to vaccination, were more hesitant about vaccines in general, and the flu vaccine specifically, more likely to believe in conspiracy theories and use naturalism as an alternative to getting vaccinated. Oh, us wacky conspiracy theorists, huh? Talking about things like, lockdowns and pandemics and, microchips and digital currency. And you remember all those quaint things that used to be conspiracy theory that are now going on right in your face, right? Well, us wacky conspiracy theorists, here we go again. And naturalists, oh, natural medicine, oh, that's man, that's bad stuff right there. Seriously, this couldn't be any more blatant of a type of propaganda machine here. I mean, I know it's coming from the New York Times, so it's not a surprise that it's propaganda, but, come on. They can't get much more blatant than they are here. Let's read on. Across all demographic groups, perhaps the most striking reason given for avoiding the flu vaccine is that people do not see it as efficacious as, say, the measles vaccine. Indeed, it is a good vaccine, but not a great one. Okay. Yeah, there's no such thing as a great vaccine or even a good vaccine. Okay, let's continue on. It must be repeated annually. Well, that should tell you something about it right there. If you get it and then you have to get it again next year, it's nonsense, folks. Okay? Immunity takes up to 2 weeks to kick in. but its efficacy also depends on how accurately infectious disease centers worldwide forecast which strains are expected to circulate in the coming year. And then those strains can mutate. Okay, so here it is. They're telling you it's a good vaccine. Okay, it may not be so effective, but that's only because they have to accurately predict what strain they think it's going to be, and then, even if they do, then sometimes they mutate. Now, hold on a second. Think about this. Okay. What are they basing this whole premise of this stupid COVID-19 vaccine thing on? They've already talked about it mutated like 4 or 5 times or something already. How is this going to be in any way effective? Think about it. Even if you go at it from the narrative that they're telling you the absolute truth in the mainstream narrative of all of this, and that vaccines really work like they say, think about that. They just shot themselves in the foot with that kind of logic. So let's get back to the article. I'm sorry. I find myself amused sometimes by the stupidity of the people pushing these agendas. Although the flu shot confers immunity at all ages over 6 months, that's a blatant lie right there. Flu shots do not confer immunity. No vaccine has ever conferred immunity to anything. And that's even according to mainstream science. So that's a fallacy in and of itself right here in the article. But let's continue. Although the flu shot confers immunity at all ages over 6 months, it can be less complete in people over 65. See, maybe I should do the fact checker thing on these people, because that's nonsense. It does not. No vaccine confers immunity. It'll even tell you in the product description, in the vaccine package insert, that they do not confer immunity. They've never been able to prove anything even close to that. So that's a fallacy in and of itself. So maybe I should do some fact checking on some of these organizations, just to kind of humble them a little. But anyway, back to the article. Depending on many factors, the shot's effectiveness in a given year can range from 40 to 60%. More like 15 to 30, folks. Okay? That's the truth of it. Those are highly inflated numbers. That, again, that's not an average. They have no average. They have no way to really track this. So, just even the numbers they've reported the past couple of years have been severely, bad. Way worse than that. 15 to 30% the past few years. But a vaccine not given won't protect anyone. A vaccine given won't protect anyone either, said Dr. Jane R. Zucker, Assistant Commissioner for the Bureau of Immunization at the New York City Health Department, which has been hosting webinars for providers about how to have conversations about the flu shot with hesitant patients. Really? I've had some interesting conversations with doctors in the past, and it's like talking to a brick wall. It just... They only know the talking points that the vaccine product rep gives them to talk about with it. They've never actually looked at a vaccine insert or done more than maybe about a day's study in vaccine science at all. And I use the word science very loosely when it comes to vaccine science. Yeah. So this is it. They're trying to get people, these people to have conversations about the flu shot with hesitant patients. So they're trying to get the doctor to talk you into it. Now, doesn't that kind of violate the informed consent aspect of this? I think it really does. If you have somebody trying to talk you into it. They used to call people that tried to talk you into something you're hesitant into buying as a snake oil salesman, didn't they? It's the same kind of thing right here, except now this is government mandated and officially mandated by the health departments that they want them to try and talk people into something they're not comfortable with. As health officials note, should a vaccinated person contract the flu, the severity will almost certainly be reduced. Hospitalization rarely necessary. Especially with COVID-19 raging, public officials reason those odds look pretty good. Another reason people give for not getting the shot is they think it makes them sick. How many people do I know personally that have said, I got the flu shot and I got so sick, I'm never getting one again? Let's continue with the article, though, because this next statement in the article is interesting. It's a quote from a Patsy Stinchfield. Let me read it for you. Quote, People who say I'll never get it because it gives me the flu have not had the flu and don't know what it is, end quote, said Patsy Stinchfield, Senior Director of Infection Prevention at Children's Minnesota. You've never had the flu. If you say you had the flu after getting the flu shot, you've never had the flu. Ay, ay, ay. These people, I'll tell you. What you're feeling is your body's immune response to the virus's antigens, said Miss Stinchfield. No kidding. Thank you, Captain Obvious. What is the virus's antigens? Well, that's this part of the virus that makes you sick. Okay, so, all right. And so she's arguing, no, it's not the virus that's making you sick. It's the parts of the virus that make you sick that's making you sick. Oh, okay. Thanks for clearing that up, Doc. I just laugh. I'm sorry. I'm so amused by this because these people are the quote-unquote experts in the field. All right. Anyway, back to it. So, what you're feeling is your body's immune response to the virus's antigens, said Ms. Stinchfield, a member of the CDC's influenza work group. No kidding. It's amazing how they all tie back to all these agencies, these government agencies, and all these big pharma corporations. It's a revolving door. It's a who's who of the pharmaceutical world. They take various positions within the actual supposed, alleged regulatory committees. And they get these cushy jobs with these big pharma corporations, and it's a revolving door there. It's ridiculous. It really is. It's corrupt top to bottom, folks. It really is. So here we go. Let's continue on. She says, you may feel flu-ish, and that's a good thing. It's your body's way of saying, I am ready for the flu, and I won't get it. I won't get as sick if I get the real one. Really? No, that's your body's immune system when you get the symptoms fighting off a disease, folks. Same thing, whether it's artificially induced or naturally induced. It's the same thing, but I would argue that the artificially induced diseases and things of that nature, artificially induced antigens, are much worse than the natural ones, and your body has a much harder time fighting it off. But that's neither here or there. Let's get back to the article. We're almost finished here. Thanks for sticking with me this long. Public campaigns will describe the shot as a critical weapon during the pandemic. Hopefully people will say, there's no COVID vaccine, so I can't control that. But I do have access to the flu vaccine, and I can get that, Miss Stinchfield said. It gives you a little power to protect yourself. No, I don't think they're really understanding the thoughts of the public here on this thing. Maybe a lot of the sheep will line up and say, yes, give me the flu shot. But, there's a lot of us that are not. And I've talked to a lot of people. I know a lot of people who are not buying into this whole COVID shot thing, first of all. And second of all, the vast majority have an aversion to the flu shot as well. And that's for good reasons. So, I don't know if their whole marketing campaign or brainwashing campaign that they're trying to put together with this is going to work or not. We'll see. Only time will tell with that. But back to the article here. Other campaigns will emphasize familial and community responsibility. There you go. They're going to use guilt tactics to try and, force you into doing this. Well, if you don't get your flu shot, your grandma will die because of you. That kind of thing. Usually flu vaccine compliance rates among people's ages 18 to 49 are low. Vermont's, for example, is only about 27%. Christine Finley, the state's immunization program manager, believes that rates will improve because of the pandemic's stay-at-home households. People are more aware that the risks that they take can negatively impact others, she said. They're often taking care of young children and older parents. If any example could prove instructive about protective behavior in flu vaccines during the coronavirus epidemic, it could well be Australia. See how they're trying to make Australia look like a good model for what to do in this whole thing? Do you know how draconian Australia is right now, folks? Have you been paying attention? Do you know anybody in Australia? I know some folks in Australia, and it's nightmare. It's a nightmare. It's an Orwellian nightmare there right now. They can't even leave their friggin' house. It's that bad. they're only allowed to go 3 kilometers, and they have to have a very good reason to do it, whether it's to go to the grocery store to get groceries or for a medical appointment or things of that nature, for necessary, essential business. And they can only go up to 3 kilometers away from their home. And they actually have thug police out in the streets, like patrolling, like militarized type police. It's outstanding. It's bad, but they're holding this up as the model for what we should do here in America. And I'm telling you, that's bad news here in America, because we still have guns and people aren't going to stand for it. Australia's flu vaccine rate tends to be modest, but this year demand was high. The government's rollout of the shot began earlier than usual for the June through August winter because the coronavirus pandemic was exploding. Though the government had also issued strict no-entry limits among many states and territories and bans on international travel, the flu shot was one of the few reasons people could emerge from lockdown. Lockdown. One of the few reasons people could emerge from lockdown. Go get a flu shot. That's obscene. The prevalent strain circulating in the country is type A, the most common and virulent form of flu, said Dr. Kelly L. Moore, a public health expert at the Vanderbilt University School of Medicine. According to the CDC, type A is the most likely to circulate globally. It mutates readily, particularly as it jumps between animals and humans. Wait a minute. It mutates readily? Then what good is a flu vaccine going to do against this thing? Anyway, back to the article again. There are 2 strains of type A influenza in the vaccine, Dr. Moore said, and so the very best way to protect yourself is to get the shot. Really? I don't think it is. I think if you, take vitamin C and try to eat healthy foods and vitamin C, magnesium, things of that nature, you might have a little better chance against something like that than going and having it actually physically injected into your body, and just use common sense things like wash your hands. And I digress. I'm not going there, but because we got to finish this up. Anyway, reported cases of flu in Australia have dropped 99% compared with 2019. Well, no kidding, because everything gets reported as COVID. And, Australia's milder than usual flu season is likely the result of a number of factors. Strong flu vaccination uptake, social distancing, but also severely decreased movement of people. Said Dr. Jonathan Anderson, a spokesman for Seqirus, a supplier of flu vaccine. But though American public health authorities usually look to Australia's flu season as a predictive, Australians say this year's is not a reliable indicator. Of course not. Everything got classified as COVID, so how are you going to know what the real numbers are? This situation is of no comfort, as these measures do not apply to the United States, where the populace has never been effectively physical distancing, nor have the country's entry restrictions been as onerous, said Dr. Paul van de Bondier, a public health professor at Griffith University in Queensland, Australia. So they're saying that in the United States, the populace has never been effectively physically distancing. Okay, I live in Pennsylvania, where we've been on lockdown since March the 11th or the 15th. I forget which day it was. Somewhere in that time frame. Everywhere I go, you still see people walking around with the dopey masks on and trying to physically distance themselves. And it's ridiculous, and it's prevalent even still. But they're claiming that in the United States we've never effectively done that. Why? Because we've never effectively locked people in their homes and had police standing outside waiting to beat them or arrest them and that kind of thing. Because we haven't gone completely draconian just yet. Is that what they're saying here? That's kind of the impression I'm getting. It is likely they will have a significant influenza season this northern winter, he said. Oh, that smug guy. What's this guy's name? Paul Van Binder. Dr. Paul Van Binder, Griffith University, Queensland, Australia. This is another one of those social engineer types, folks. These people, they put the narratives in place, and, They tell you this kind of stuff. It's likely they will have a significant influenza season this northern winter, he said, even though he hasn't really uh, been here or seen. I'm assuming he probably hasn't been here and seen, how people are here or what's really going on here. But this is the narrative they want. So this is what he's going to say. And that's pretty much it. That's the end of the article. That was the last line of the article. It is likely they will have a significant influenza season this northern winter. And with that, they are trying to push this whole narrative that there's going to be this massive flu season combining with this whole COVID nonsense thing and creating the quote-unquote Twindemic. And that we need to fear the quote-unquote Twindemic. And you can see how they're invoking the Gemini archetype as we go into the fall here. And, there's a lot of esoteric things associated with this, and this is kind of what they're trying to leverage off of. They're trying to leverage off of these esoteric or occult type ideas and energies that do occur in our world, and these different archetypes. They're trying to leverage those in a way against the public in order to keep the public in this new normal, this state of the new normal, wearing the mask, only going out when you absolutely have to, fear your fellow man, detach from society at large. That's what it's about. It's breaking the human spirit. That's what it's about in the long term. Breaking the human spirit to make way for the transhuman or post-human spirit. And that's what all of this is leading to, no doubt in my mind. But anyway, thanks for hanging out with me, guys. It's been a good time here. Looking forward to looking in the future at more of these types of agendas in play and breaking them down and hopefully laughing at them a little like I did here. Anyway, thanks for hanging out with me, guys. Like and subscribe. Thanks.